Hi and welcome again to my channel. I'm Ebola, your baby's doctor. So today we'll be talking about something I promised in my last video. I said I was going to make a video and talk about viral infections. So that's what I'm going to talk about today. From the last video I made, I got some requests to make some videos. Someone asked me how to take care of catarrh in children. That's runny nose, nasal discharge. And then someone else had asked me earlier to make a video on how to properly steam a child. So I'm going to make another video where I'm going to put those two topics together and make a video probably for next week. But this week we'll be talking about viral infections, what they are, how to recognize them, and how to manage viral infections. Thank you so much for joining me. If you're just coming for the very first time, it's very nice to have you here. I'm always excited to have new people here. If you have not subscribed to my channel, it's very easy. Just click the subscribe button. It's right underneath this video, just under it. Click it. It only takes you about 5 seconds to do that. Thank you so much for joining me. I'll be with you shortly. Alright, so welcome back. Infections generally are classified into a lot. We have viral infections, bacterial infections, fungal infections, protozoal infection, and I can go on and on and on. But there are three major ones, which I've mentioned already: viral, bacterial, and fungal infections. And in children, viral infections are the most common ones. Those are the ones that you see. Those are the ones that your children will usually have. So that is why I'm paying more attention to viral infections, how to recognize them, because I have a lot of parents coming to the emergency room with children that have suspected viral infections. And of course, when you say, Madam, this is your baby that we brought today, I'm not going to do much, I'm not going to do anything, I'm just going to give, symptomatic management, they are worried. And then they leave us and then they go to another place where they give them antibiotics and all that. But the truth is, antibiotics would never work for your viral infections. Viral infections, most of them will run their course and then go. So that is what we are going to talk about in this video. Now, most of the viral infections that your children will have would present with fever, runny nose. Sometimes they could have a rash and cough. Those are the common things that you see in viral infections. The child has a cough, runny nose, fever, sometimes could have a rash, itchy eyes. Those are the common things that you will see in viral infections. So when you come to the hospital and you say, okay, my child has runny nose, and then you describe the runny nose as watery and all that, I'm already thinking of a viral infection. And like I said, it is the most common cause of infections in children. So it's easy to recognize. Even parents can recognize it. Of course, I'm not saying that if your child is sick, you shouldn't get to the hospital. But I want you to just understand the reason why a doctor or a pediatrician might not give you antibiotics or anti-malaria or whatnot when they are suspecting viral infections. So viral infections will usually affect, most of the time in children, will affect the nose, the airway, the lungs, of course, and then of course it can affect the skin, the eyes, and that is the constellation of symptoms. Now, there are plenty viral infections. I can't not even mention. Ask me to mention like 100 now. I think if I start, I'm going to mention that, but then I'm going to take a lot of your time, so I'm not going to do that. But there are a lot of viral infections. There are the ones that will have rashes, like chickenpox, measles, rubella, and all those. There are those that would just have runny nose or sore throat, like rhinoviruses. There are ones that can be very serious as to cause some chest infections, like respiratory syncytial virus, and so on, influenza, parainfluenza virus, and so on and so forth. Okay, so they can actually really have mild symptoms, but sometimes you could actually have viral infections that could really go bad. And in this case, some of these viruses might need antiviral treatment. But in a lot of cases, most viral infections will spend the number of days they want to spend and go. And that is the joy of viral infections. They spend the number of days, whether you treat it or not, they spend the number of days they want to spend and they go. So the main work of the parents and of the doctor is to make sure that the child is made comfortable as possible while the child is undergoing this unfortunate infection. Now, what you need to understand is most viral infections are airborne. So yeah, that is me telling you that there is almost nothing you can do to prevent it. They're in the air. So the child goes to the crèche, goes to school, daycare, someone sneezes, someone coughs, they share things, they share their virus, they play together and all that. You can't prevent that, okay? And that is how most children get viral infections. Of course, in severe cases like maybe varicella, that's one that causes chickenpox and all, when the child has a rash, most schools will say, okay, this child has a rash, don't come to school, don't bring this child to school, and all that. But truthfully, in a lot of cases, they are not preventable because they are airborne. At least if they are waterborne, you can say boiled water. If they are whatever, you can say hygiene and all. But most viral infections are airborne. Is there a sad news? Yeah, I think so. So at least your children will have viral infections at some point. Now, I've told you how to recognize viral infections. I've given you the unfortunate message that it is actually not very easy to prevent viral infections. So what do you do when your child has viral infections? Well, like I said, they present with fever. Okay, so if your child has fever, the temperature is high. One thing is, of course, I made a video like a few weeks back when I talked about how to manage fever in children. Okay, so you can do all those things: tepid sponging, cleaning your baby, giving your baby a shower, or of course, if it's necessary, you can give medications like acetaminophen, ibuprofen, and all that. If the child has a runny nose, in a lot of cases, I would not prescribe medications for runny nose, and a lot of pediatricians will not prescribe medications for runny nose. Instead, we can advise that you steam your child, which I'm going to make a video because now I see that I have to make the video. All right, you can either steam your child or you can put saline drops in the nose. All right, so I think I'll try to show you all this in the video I'm going to make next. So the management of viral infections are mainly symptomatic. So whatever the symptoms the child comes with, the child has a rash that is itchy, you can give calamine lotion, or you can even give some oral antihistamines. So management of viral infections are mostly symptomatic. You would almost never see us give antiviral medications for runny nose and all that. So please, if anybody is offering you those, I think you should actually ask questions, because in a lot of cases, viral infections will run their course and then go. Of course, there are exceptions, like you already know, COVID-19. It's also run its course, but its course can be actually deadly, you get. Yeah, and then some other exceptions like HIV and all that. So yeah, basically that is it about viral infections. You need to understand that when you go to the hospital and they're suspecting a viral infection, a good way to know if the child has a viral infection is to run a test, what we call a PCR test, for whatever it is that you're suspecting. But the truth is, PCR tests are quite expensive, at least in my environment. So we don't routinely run PCR tests to look for the antigen of the virus. But what we do is we can run a full blood count. Most of the time when your child has a viral infection, there are some cells that we call the lymphocytes. They are the ones that actually fight viral infections. So they are likely to increase during the episode of the infection. So when we have lymphocytosis or increased lymphocytes, it will suggest to us that a child has a viral infection, and then we'll go ahead to treat your child as someone that has a viral infection. So basically, that is it. Now I believe you can recognize it. And now I think if your doctor says that he or she is not going to give your child antibiotics because he's suspecting your child has a viral infection, you're not going to fight, right? I believe you're not going to fight. So yes, I've already told you the things to do. Avoid overcrowding, rehydrate or hydrate your child very well. Give a lot of fruits and veggies. Those are the things that you can humanly do. But the truth is, your children will go out and come back with viral infections at some point in their life. It's quite unfortunate, but that is the way it is. And that is just part of them building up their immunity for a better life in future. So that is it about viral infections. Very simple, right? I mean, after all this, my videos, whenever you watch my short video, you should be able to become a doctor and make diagnosis. I think that's just is that simple. So thank you so much for joining me again today. I promise to make a video on the catarrh, runny nose, and how to steam your child for next week. If you have not subscribed to my channel, I told you to do it in the beginning of this video, but in case you decided not to do it, then now is the time. It's so hot now. It's so hot. It's so hot. I'm so sweaty everywhere. It's hot. So please remember, yeah, it's hot. The temperature is getting hotter. We are getting into the dry season in Nigeria. I know some people are getting into their cold season. Well, thank God for the diversity. But if you're in Nigeria and it's getting really hot wherever you are, please ensure that you get hydrated. You need that water. You need to drink a lot of water, because this is the time when you use a lot of water and you can't afford to be dehydrated. So yeah, see you next time, and take care of yourself. Have a very hot week or cold week wherever you are. Bye.